Hello everyone, my name is Derek Mabry. I work for Health Markets Insurance. I'm an insurance broker and excited today to talk to you guys about Medicare. Medicare can be confusing, especially this time of the year. You're probably all receiving quite a bit of information about your specific Medicare plan and what options are available to you. And so that's kind of my goal today, is really just to educate you guys. During these educational seminars, I cannot get into like plan specifics, but I can kind of give you a basic overview of your Medicare options. And then if you ever want to set up a no-cost consultation, I'd be more than happy to do that or answer any real questions that you have one-on-one. First off, here's a picture of my beautiful family. I got 3 kids, I'm married, I live in Granger. I've been in the health insurance business for 9 years. I really specialize with people who have retired early or people who are on Medicare. I'm licensed in Indiana and Michigan, but I also have licenses in many other states. A lot of my clients end up being snowbirds or end up moving. So whenever that happens, I get licensed in other states so I can continue to help them. I'm 38 years old. I plan on doing this for the next 27 years until I'm in your position where I'm on Medicare. So if you ever have questions, I'll be more than happy to help you for at least the next 27 years. And my service is of no charge. Some people will think that us insurance agents make a lot of money and kind of people are confused on how we get paid. The insurance companies pay us to help you. So I'm here advocating for you. I'm here helping you understand the different options. And you pay the same rate whether you figure this out on your own or whether you go through me. And again, I try to help you look at all those different options. My office is in downtown South Bend, and I meet my clients in their home in centers like this over Zoom if people want to do it electronically, so I can really meet you wherever you please.
Is that a Little League?
That's what Little League, yeah. So I actually coach my daughter's Little League team. We play for Chet Wagner in South Bend, and she's only 8 years old. We actually won the state championship for softball this year.
Woo-hoo.
So I spend like every single weekend. I feel like I live at the ballpark. We had a tournament last weekend. Our first game was at 8 a.m. and our last game was at 9 p.m.
Oh.
And that was Central Time. So this last Saturday, I think we spent 14 hours at the ballpark. And with a 3-year-old there, it was interesting, to say the least. So no, I like to kind of give back to the community. I sponsor our team, but it's just something I really enjoy, kind of playing with the kids. So my little one will be in T-ball next year, so I'm going back down to coach T-ball in the future. So that's where I really excel, is the little ones. Medicare is confusing. Everyone has different needs. Everyone has different medications, health needs. And so what I help you do is kind of navigate all of the different options. And what my advantage is I'm licensed with every major Medicare company, both in Indiana and Michigan. So I represent Priority Health, Humana, Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, all of the major carriers. And so what I do is I sit down with my clients one-on-one, say, hey, here are all of your different options, and kind of help them determine what is the best for their situation. There's so many different types of Medicare plans. Some people have Medicare supplement plans. Some people have a Medicare Advantage plan. Some of these plans come with prescription coverage, come with dental, come with vision. And being that there's so many different options, I can really help you simplify what is the best for your situation and your budget. So what is Medicare? Medicare is a federal program, provides health insurance for people who are 65 and older. Now you can also be on Medicare if you're under 65, and to qualify for that, you'd have to be on Social Security disability for 24 months or have end-stage renal disease. So there's your Medicare card. Hopefully you all have that. They've switched the Medicare numbers. It used to be your Social Security number. 2 years ago, they started changing that to a specific Medicare ID number without your Social Security. So if you do not have that card, that is something that you should request from Medicare, and I can give you that information if you need to, because we no longer use your Social Security numbers as your Medicare number. You become eligible for Medicare on the first day of the month that you turn 65. So for instance, if your birthday is October 12th, your Medicare would start October 1st. And so with Medicare, you have two main components of original Medicare: Medicare Part A and Medicare Part B. So we're going to start with Medicare Part A. Medicare Part A is hospital insurance. So it's when you're inpatient in the hospital is when your Medicare Part A comes into play. So it covers, again, inpatient hospitalization. It covers skilled nursing facilities. It covers hospice care, and it covers home health care. So that's what Medicare Part A is. And for the majority of people, Medicare Part A is of no cost. You get Medicare Part A for no cost if you have worked for 40 quarters or 10 years. If your spouse qualifies for Social Security, that would also qualify you for Medicare Part A. And if you have neither of those, you will pay up to $471 for Medicare Part A. Very rarely do I run into anybody who does not qualify for Medicare Part A. I've been doing this for 9 years, and I probably have had maybe 10 people in the last 9 years who don't qualify for Medicare Part A. So that is pretty rare. Medicare Part A has a $1,484 deductible, and it covers, that $1,484 covers your first 60 days in the hospital. From days 61 through 90, you would have a copay of $371 per day, and then you would have a lifetime maximum of 150 days, which you thus pay $742 per day. The majority of people do not have to worry about those co-payments because they've picked up a different policy. Medicare Part A also covers so with the majority of Medicare plans, you don't pay anything for the first 20 days in a skilled nursing facility. And then from days 21 through 100, you pay $185 per day. Medicare only covers 100 days in a skilled nursing facility. So there's a lot of misconceptions there that they'll cover you forever if you're in a nursing facility. They'll cover up to 100 days in a skilled nursing facility. Now we have Medicare Part B. Medicare Part B covers medical services and supplies. They're going to cover your outpatient care, your preventative care, if you need to go in an ambulance, durable medical equipment, physical therapy, really anything that you're not inpatient in the hospital. That would all go under Medicare Part B. Medicare Part B is not $0 a month for the majority of us. Medicare Part B is currently at $148.50. They're estimating that it's going to go up roughly $10 per month, but currently that has not been released. The current data is $148.50 for Medicare Part B. Medicare Part B has a $203 deductible. So again, we have $1,484 for your medical deductible on Part A, $203 on Part B. Both Medicare and our Part A and Part B covered 80%, you're responsible for 20%. So I'm hopefully the majority of you in here have both A and B, because once you have A and B, that's where we can really get into the additional options that are available to you. What Part A and B do not cover, they do not cover prescription coverage. They do not cover dental. They don't cover vision. They don't cover chiropractic care, long-term care, any of those additional factors. So once everyone has Part A and Part B, again, Part A is traditionally $0 a month. Part B is $148.50 per month. Then we pick one of two routes to go. So I always tell my clients, hey, when everything's said and done, we have really two ways that we can go, or two paths that we can go with Medicare. Either we can keep original Medicare A and B and add a prescription drug plan and add a supplement plan to pick up the 20% that Medicare doesn't, or you can combine everything into one, which we call Medicare Advantage. So again, there's two options. Either we do the supplement plan and the drug plan, or you go to Medicare Advantage. So the cost for a Medicare supplement plan, we always pay, again, our Part B premium, $148.50, and then we pick out a supplement plan. Supplement plans typically range anywhere from $98 a month up to $300 per month. With Medicare supplements, your price increases every year. Typically, most carriers do it on your birthday. It's not a very good birthday present. That's typically when your premium will increase each year on your birthday if you have a Medicare supplement plan. prescription drug plans in this county, we have, I think there's 23 prescription drug plans in Berrien County. They range anywhere from $7 a month all the way up to $113 per month. This slide can be extremely confusing. These are all the different Medicare supplement plans that are available in Michigan, okay? The Cadillac plan a couple years ago was called Plan F. Plan F stood for full. So if you have a Medicare Plan F, then they pick up all of your co-insurance and all of your deductibles on your Medicare. But Plan F is no longer available for anybody new turning 65. Medicare and CMS got rid of that policy January 1st of 2020. So kind of the new, let's call it the Cadillac plan, would be a supplement plan G. So if you were turning 65 and you were enrolling into a Medicare supplement plan G, it would run you right around $100 per month. And the only thing that you would spend in a calendar year is your deductible, which would be $203. So those are all the different supplement plans that are available here in Michigan. Medicare Part D and prescription coverage is one of the biggest factors that I help my clients with each year. These drug plans change their formularies each year. A lot of people are on high-end medications. There's so many different prescription drug plans in the county. It's always very important, and something that I do with every single one of my clients each year, is we go through each of their medications to make sure that they're on the right prescription plan. So again, we have 23 different plans here in the county. What I do is I put all of my clients' medications in a formulary, and it shows me which plan, based on all of their medications and their dosages, will save them the most money per calendar year. So that's something that if anyone has questions or wants me to run their prescription numbers, I'll be more than happy to do that to make sure that they're on the right policy.
Is that why so many people have changed from year to year?
Yes.
To year?
Yes. You get on a new medication one year, maybe your current plan doesn't have that medication in their formulary, and then if you don't change that each year, you're kind of stuck with that policy and paying a higher cost for that medication. So that's one of the biggest issues with Medicare, is that they're always changing these drug formularies. Prescription drug costs are just kind of going through the roof. It's one of the biggest issues that I run into people with, and that's something that I always help people go over, because that's usually your biggest cost per year is your prescription coverage. And then this is where people get confused, because then they hear the word donut hole. Does anybody know kind of how the donut hole works? It's extremely confusing. So here's what the donut hole is in Medicare. These are the 2021 numbers. 2022 open enrollment doesn't begin here for a couple days, so I can't show you the 2022 slide yet, but it's very similar to this year. So here's how prescription coverage works for anyone on any Medicare plan. First off, there's typically a deductible, especially on prescription drug plans like standalone prescription drug plans. There's typically a deductible. So you might owe the first $445 of your medications per calendar year. Now, once you've hit your deductible, then you get into the copay scenario. So, hey, this medication's a $2 copay, this medication's a $40 copay. And once those numbers and once those copays add up, once they add up to $4,130, then you fall into the donut hole. And again, they're not going off what you pay per year, they're going off the retail cost. And that's always the issue. The retail costs for some of these medications are sky high. For instance, if you're diabetic and you're on insulin, some of these diabetic medications are $700, $800 per month. So once the retail cost of those meds hits $4,130, then you fall into the donut hole, also called the coverage gap. And so what that means to you is you went from paying a small copay for that medication to then you go to pay 25% of the cost of that medication. So that same diabetes medication that was $800, the first few months of the year, you're only paying $40 on average per month. Then you fall into the donut hole, you owe 25% of $800. It goes up to $200, which can be a shock when you go to the pharmacy. And that's really where a lot of people get into a tough position with their Medicare. And that's why it's so important to check those plans each year, because I'll be able to tell anyone if they're going to fall into the donut hole, exactly when, exactly how much each medication will cost. And I always give my clients who are going to fall into the donut hole, I give them a printout of the cost of every single one of their medications, and when they're going to fall into that donut hole. So we don't get that call, 6 months later saying, what's going on with my medications? Why did they become so expensive? So I always kind of give my clients who are going to fall into that donut hole kind of a heads up so they can kind of plan for that throughout the year, knowing when they're going to fall into that. You get out of the donut hole once you've went through $6,550 of prescription costs per year. So once you've reached that threshold, yes, sir?
Is that with all policies?
Yes. Every single Medicare plan has to follow the same structure.
So I'm in the donut hole now, so I'm stuck the rest of the year.
You're stuck for the rest of the year until your expenses have hit $6,550, which a lot of times they won't. And if that happens, then you then owe 5% of the cost of that medication. So, but that's the biggest, in my opinion, that's the biggest issue with Medicare. That is something that is the most confusing, and that I see most of my clients running into the biggest issues is that loan thing. And being that there's so many different plans, 23 different prescription plans in the county, and there's, I believe, 25 different Medicare Advantage plans in the county, I mean, you have to kind of pick which one of those you think is going to work the best for you, which could be confusing. That's why you come to someone like us, who's of no charge, who helps you figure that out. And you get that big Medicare e-book each year that's 150 pages that has all the plans, but it just confuses you even more a lot of the time. So again, that's how the donut hole works. If anybody wants me to run their medications, I will be more than happy to do that for them, because again, that's probably going to be your biggest risk and your biggest potential expense. The other option with Medicare, we've talked about the supplement plans. With the supplement plans, you need a prescription drug plan with it. Now we're going to talk about Medicare Advantage. Those are the ones that we see with Joe Namath on the commercial every 30 seconds this time of the year. So Medicare Advantage plans are through private health insurance carriers. And a lot of people are hesitant because they say, how could a decent health insurance plan be $0 a month? Sometimes that just doesn't make sense to a lot of people. Well, how it works is you've paid into Medicare for your entire life. Every check that you've ever received, you've typically had a Medicare premium coming out of it. The government's not too efficient at running Medicare. So what they'll do is they'll have a private carrier. In this area, Priority Health, Humana, Blue Cross Blue Shield are kind of your main three in this county. And what they'll do is they'll pay them. So they'll say, hey, Priority Health, you take on this client, we'll pay you $12,000 a year. You take care of all their medical expenses. So these health insurance companies receive roughly $12,000 per year per enrollee. So they get 12 grand a year. So they're fighting over all of you. They're all fighting over saying, hey, come to our plan. So what are they going to do to entice you to come to that plan? They're going to give you all the bells and whistles. They're going to give you dental, they'll give you vision, prescription coverage, free gym membership, all these additional perks for you to come to their program and get out of original Medicare. And a lot of the plans in this county are $0 a month. The three major carriers all have a $0 PPO plan in this county. So there's some great plans here in the area. So if you have a Medicare Advantage plan, all you'd have to pay, if you book the $0 plan, is your Medicare Part B, $148.50.
So they pay for the book stuff? Or?
Yep. So that Medicare Advantage plans cover health, prescription, dental, vision, everything bundled into one plan. And those are more similar to like a traditional group health insurance plan that probably many of you had in the past. There's two different types of Medicare Advantage plans. The plan that I'm going to show you right now, I never recommend, especially in this area, being that we're close to a state line. Those are called HMO plans. There's two different types of Medicare Advantage plans. We have HMO and PPO. HMOs are health maintenance organizations. The issue with an HMO policy is that you have to stay inside of your network. We live so close to a state line, it's a huge issue. For instance, if you wanted to go into South Bend, for instance, a lot of the HMO plans won't have Beacon. In this area, they won't have Beacon in network, or potentially St. Joe, or certain doctors in your network. So that's the issue with an HMO plan. And with an HMO, you have to see your primary doctor and then get a referral to see a specialist. So you have to go through that extra step. So we do offer HMO plans in this area. I probably have 700 clients. I don't have a single one who's on an HMO plan. Everybody who I help is on a PPO plan because PPO plans are also a lot of times $0 a month. The biggest difference between an HMO and a PPO is typically on these PPO plans, you can go anywhere in the country that accepts Medicare. So we're not worried about a network, and we don't need a referral to see a specialist. So if there's a specific podiatrist or dermatologist that you want to see, you don't have to go and sit down with your primary doctor and have them refer you there. You can just go ahead and make that appointment on your own. So that's the big difference between HMO and PPO. And again, a lot of these Medicare Advantage plans, they're going to give you all the additional benefits. So dental, typically on most of these plans, you're going to receive dental. Dental typically covers cleanings, x-rays, exams. Typically, the majority of these plans cover $1,000 a year for dental services. They're going to cover vision in your vision exam. These plans offer anywhere from $100 up to $300 per year for eyewear. These plans will give you a free gym membership. A lot of times it's called Silver Sneakers, which allows you to go to participating gyms and go to those gyms at no cost. Many of them, especially this year, are giving you money to purchase over-the-counter medications. Some of them will give you a gift card, some of them will make you order online, but you'll receive a card and you can purchase vitamins, you can purchase cold and allergy medication, Band-Aids, anything that you can find at a drugstore, they'll give you a credit so you can go to do that. They'll give you, a lot of times, a personal emergency response system. My grandmother has been paying for one of those I've fallen and I can't get up systems for the last 5 years, where now her policy covers it, so we were able to cancel that service where she was paying $70 a month for it, and she was able to get one for no cost. So they give you all these additional perks, and they can afford to do that because Medicare is paying them to take you on. And again, they're fighting for clients to enroll into their plan, thus giving you all of those additional options. Also cover acupuncture and chiropractic care, which traditionally on Medicare is not covered. So again, those are the Medicare Advantage plans. And really on either one, they're good. And what these Advantage plans do, they've done the studies, they've done the math. Hey, if people regularly go to the dentist, they are at a lower risk of having heart problems, for instance. They have proven that if, obviously if you're going to working out and using the gym, you're less likely to be a diabetic, which would thus lower their expenses if you had any medical issues. So they do a much better job of managing your health and giving you those additional options, such as dental, such as vision, such as vitamins, to help you promote a healthy lifestyle. Kind of in general terms, if you have a lot of health issues and you know of a lot of medical expenses that you're going to incur, typically a Medicare supplement plan is potentially, depending on the price, a safer option, because that really limits what your medical expenses are throughout the year. So for instance, if money wasn't a big factor to you, you're living extremely comfortably, and you had a Medicare supplement plan, and you weren't worried about how much the premium was increasing, keep the supplement plan. Don't have to worry about any medical expenses, because they really cap you out. Where on the Medicare Advantage plans, they're really better suited for individuals who want a lower premium, who would rather have a little bit more skin in the game and pay some premiums and some deductibles as they go. The average Medicare Advantage plan in this county has a maximum out of pocket, the most that you can spend in the calendar year, around $4,000 to $5,000. But it's only about 2% of people per year hit that maximum. So a Medicare Advantage plan typically will have no deductible. There's just small co-pays for all of their services. So typically, primary doctors, no cost. Lab work, no cost. Preventative care, no cost. But you might pay $40 to see a specialist. You'll pay roughly $250 to have a surgery done. And those co-pays will kind of add up per year, and they could potentially spend $4,000 to $5,000. But again, pretty rare. Roughly 2% of people per year in 2020 hit their maximum out of pocket on a Medicare Advantage plan.
Was that nationwide?
Nationwide. The Medicare Advantage is really exploding because of all the additional benefits that they're getting, and those plans keep getting lower in cost. My go-to plan in my county in St. Joe County, when I first started in the business 9 years ago, it was about $70 a month, and this year it's $18 a month. So we're seeing a shift. We're seeing those plans get much less expensive. Medicare supplement plans are going the other direction. And so it kind of depends on your situation on what's the best route for me to do in my specific situation. If you're already 65 and you are currently working, you do not have to go to Medicare. You do have that option. You can always keep group insurance. So if you continue to work past the age of 65, you're going to have the option. Is it more beneficial to me to go to Medicare, or is it more beneficial to me to stay on my group health insurance plan? So you do have that option. A lot of people think that they're going to be penalized if they turn 65 and they do not jump into Medicare. That does not apply if you have other group health insurance coverage. So if anybody ever has questions about that, what should I do? I sit down with clients all the time if they're continuing to work past 65, and we'll kind of do a chart. How much are you paying per month? How much is Medicare? What's the deductible on each plan? And I kind of help them make a good decision on what's the best for their situation. Enrollment periods for Medicare. Open enrollment begins, the annual election period begins October 15th. We are in what we call right now pre-open enrollment. So right now I'm going, with all my current clients, I'm going over all their medications on the new plans, where I'm doing all the reviews with my current clients. And then October 15th is the annual election period where we can officially change plans or sign up for plans. So October 15th through December 7th is the Medicare annual election period. Now, if you have a Medicare Advantage plan, 2 years ago, we started with a new program called the Open Enrollment Period. So October 15th through December 7th, we can select a plan. If you select a plan and you want to make a change, you now have the open enrollment period from October 1st all the way until March 31st. So in the past, you only had that less than 2 months to make a decision. Now, on most of the plans, especially the Medicare Advantage plans, we get an additional 3 months, which is great. Sometimes I'll run into a client who forgot to check their medications 1 year on their Advantage plan, and let's say they're on a new med and it wasn't covered. It's nice that we have that additional 3 months to help them make a decision or change their plan if need be. Again, when you turn 65, you get 3 months before and 3 months after you turn 65 to pick out a Medicare Advantage plan. So there's kind of a 7-month window there, 3 months before and 3 months after. That's called your individual enrollment period when that happens. Now let's say you guys move or somebody moves in the middle of the year. Then you get what we call a special enrollment period. So a special enrollment period is a 60-day window. If you were to move, if something major like that were to change, we'd be able to go back in and change your plan in the middle of the year and get you coverage in that county. Those commercials that we see on TV, there's Joe Namath. He says, we'll give you free rides, we'll pay your Medicare Part B, we'll cover this, we'll cover that. Those plans and what those commercials are trying to do is to see if you're eligible for Medicaid. So if you're eligible for Medicaid, if you're low income, you might not have to pay your Medicare Part B premium. You might be able to get a plan for no cost and have no copays. So there's different levels of Medicaid in each state. So in Michigan, if you're eligible for full Medicaid, an individual would have to be under roughly $16,000 per year of income. A family of 2 would have to be under roughly $24,000 of income. And if you're underneath that threshold, a lot of times you would be eligible for Medicaid from the state. But that's what those commercials are doing. It's kind of somewhat of a bait and switch where they're trying to see if you're eligible for this Medicaid plan, and if not, they try to get you into a different program. Now there's different levels of Medicaid. There's also extra help paid for prescription coverage. So a lot of people might just be just over those income levels for Medicaid, but they might be eligible for extra help paying for their prescription coverage. And for a lot of people, that's their biggest expense. So if anyone ever has questions on, do we think that you'll be eligible for extra help or Medicaid to help reduce the cost, I can always give you advice, show you how to apply for those different things. I don't work for the state of Michigan where I don't apply for people for Medicaid per se, but I can always lead anyone who needs to the right directions to see if they're eligible for those additional resources. The gaps in Medicare. There's a few big, in my opinion, big gaps in Medicare. We already went over one, the donut hole. Another one is observation. And if you read your Medicare and U book this year, there's a huge section on observation cost. The number one reason why people in the United States file bankruptcy is because of medical bills. A lot of those people have health insurance. It's actually 78% of people who had health insurance have filed for medical bankruptcy. And on Medicare, it's usually one of these three things that could put people in a tough financial position. One of them is being observation. A lot of times you'll be in the hospital and you'll think that you're inpatient. You're staying the night there. But the hospital can technically put you under observation instead of being inpatient. And the issue with Medicare is you have to have a hospital stay of at least 2 days to be eligible for a skilled nursing facility. So if you're under observation for 2 days instead of actually inpatient, all of those other things don't trigger, and thus you might not be eligible for a skilled nursing facility. So if you look in that Medicare and U book, they even want you, if you're in a hospital and you're staying overnight, they want you to ask, am I technically under observation or am I inpatient? So if you ever have questions on that, please let me know. But that's one of the major things with Medicare. Because a lot of these hospitals will get fined if somebody is inpatient, they leave, and then they come back 2 days later. That is an issue, and they can potentially be charged back from Medicare. So sometimes they're putting people under observation care. So that's something to definitely, if you want more information about it, or you want to sit down and talk about observation care, please let me know. There are some additional policies that people will pick up that will pay for that if you'd like to. One of the other big issues, especially with the Medicare Advantage plans, really the only way that I was saying that there's a maximum out of pocket on a Medicare Advantage plan, and that's typically around $4,000 to $5,000. Almost everything on a Medicare Advantage plan has a set copay, except for one thing, chemotherapy. Chemotherapy on a Medicare Advantage plan is typically 80-20. The health insurance carrier will pay 80%, you'll be responsible for 20%. They say the average expense of cancer is around $30,000. And it's 1 in 2 men, 1 in 3 females that get diagnosed with cancer. So that's what I always help clients to do, say, hey, here are your worst case scenarios on every single plan. And we do offer like additional cancer policies if anyone ever has questions about them. Because again, on Medicare, that's probably your biggest risk. You're diagnosed with cancer, you can run into some big medical expenses. And especially if you're on cancer medications, that's when I almost always have my clients fall into the donut hole again on Medicare. So that's one of the pitfalls of some of these Medicare plans is cancer coverage. A lot of people get these Medicare Advantage plans to be worried about the copays. And so there are additional policies that you can get to cover long-term care, to cover skilled nursing facilities, to reimburse you for each day that you're in the hospital as well. So that's another kind of additional thing that some people like to add into their Medicare plan, somewhat to supplement their benefits and lower their out-of-pocket expenses. So I know that's a lot to go over, and I know everybody has different scenarios. Is there any questions that anybody has, just like around Medicare in general, not about their specific medications or their specific plan? Does anybody have any general questions on how?
I have a question.
Of course.
You were saying that Medicare does not cover long-term care. So when a person has to go into a nursing home, doesn't Medicare pick that up?
For 100 days. After 100 days, you are on your own.
Because I've heard the opposite, that they tell people to, perhaps maybe put their money somewhere else in a relative's name or something, because when you go into a nursing home, they want to use up your money, your funds, your savings.
Yes.
And then they will start billing Medicare because Medicare pays more. So is that true? Or?
Well, so what they're going to do is once you use your 100 days, either you're responsible for that cost, or a lot of times during that 100 days, they're going to apply for you for Medicaid. Medicaid is going to be based on income, based on your assets. So there's a lot of people who have to spend through all of their assets if they're in a skilled nursing facility over those 100 days.
But I mean, they have to go into a nursing home and they're not coming back, they're not coming back.
Then they would typically apply for Medicaid for you. But then typically you have to go through your resources. And that's why you heard that thing,
Yeah.
put it in someone else's name. That's what they're typically doing. You're going to have to burn through your assets till you get underneath that income level and that savings level. And then Medicaid will pick up the additional cost. But that's why a lot of people lose all of their assets, especially like a husband and wife. That's always the worst case scenario. You got a family of two, spouse is in the nursing home, not coming out. A lot of times that the surviving spouse burns through all their assets and all of my grandparents are a perfect example of that. 10, 12 years ago, my grandpa basically paid all of his life savings to cover my grandma's nursing care facility, which was a year and a half. So he was able to at least have the assets where he was able to pay for it, but from a financial standpoint was in a very tough, is still in a tough position because of it.
But isn't now that isn't it a 36-month period now that you have to get rid of your assets ahead of time? It used to be years ago. It was a shorter period of time, and they've increased that because too many
People were doing exactly,
doing it.
yes. And that's
so are
the,
you going to know 3 years ahead that somebody's going to have to be in the nursing?
that's always the issue. Most people don't purchase long-term care because it's so expensive, and it's so hard to get long-term care nowadays. I mean, the cost for long-term care is just skyrocketing. There's only 2 companies who are currently writing long-term care policies. So the majority of people are priced out of long-term care.
I had it, and I had to give it up because it was just too expensive, because every 5 years, it just
Huge
jumps,
price
it jumps,
increases.
it jumps.
I have a lot of clients now who are purchasing like home health care policies. So that way, if they do need extended care, they can purchase a home health care policy and get care done in the home, that the home health care policy will pay for that. Especially during COVID, I was helping a lot of clients out with that who were scared to be into a facility long-term if something major happened. So they purchased a home health care policy, which are pretty inexpensive compared to long-term care, which thus gave them the opportunity to have that care done in a home setting instead of being stuck in a facility, especially during COVID, which was scary in case there was an outbreak. So there are those additional products that are sometimes available. That's a great question. That's one of the biggest issues is, hey, they're only covering 100 days. If you have that long, extended illness, that's where you can be in a very tough financial position. If you're a single individual, you're going to burn through your assets, potentially go to Medicaid. It's always trickier when there's a spouse involved because then you have to kind of factor in, that loss of income and what to do with them.
So do you help people if I were your client and that kind of situation came up, is that something that you would help them, guiding them?
Yes. I don't work for the state, so I can't apply for you for Medicaid. I'm like your HR resource person who leads you the right direction when those things happen. So I can show you long-term care plans, skilled nursing facility policies, home health care policies that we could potentially get after the fact. Or if we think that that's going to happen, again, I don't work for the state, but I can kind of lead you down that correct path to put you in the best position that we can. Yes, sir.
Can you own a house and still qualify?
In Michigan, yes, you can still own a home. It still depends on your assets, but your home just no longer goes into that equation. It did a few years ago, but you can still own your home and be eligible for Medicaid. They still look at your assets to see if you're eligible for Medicaid, but you typically will not lose your home.
So basically in Michigan, as long as you somehow liquidate your savings in a legal way,
Yes,
you can keep your home.
yes. Good question. Does anyone else have any other questions about Medicare? I'm going to stay for a while, so if anyone has any questions one-off that you specifically want to ask.
Are you available to like consult with me over my plan?
Of course.
Currently, I have an advantage from
Okay.
United Healthcare.
Okay.
It seems to be pretty good.
Yeah. Yeah. Anyone who wants a free consultation, that's what I do. I'll give you a free consultation. I'm licensed with every carrier in the state, and my service is completely of no charge. I just help guide you. When you have questions throughout the year, I tell my clients that I can help them with 95% of the questions. There's about 5% chance that if it's like a billing issue, that I'll have to refer you to the actual insurance carrier if it's like a billing issue. But I can take care of 95% of my clients' issues, answer all questions, I've got an office down in South Bend where you can always come in when you have a question, or I can meet you at your home. And it's something that I review with you each year to make sure that you're in the right position. Because again, things change each year, health changes each year, prescriptions change each year, and I always kind of help lead you the right direction.
So I can give you a call and make an appointment.
Of course, or we can set one up today, whatever you prefer.
I noticed you had all those companies on your screen. You represent all them companies?
Yeah, and many more too. I can't fit everybody on the screen. But so for instance, every Medicare Advantage plan in Michigan, I represent. So I go through all the
Are
training.
you allowed to recommend one that you, for Berrien County, that you think is best, like Humana or?
Yes, and I can never tell you, hey, this is the quote unquote best plan, but I can say, hey, based on your needs and your situation, here's one that would. I got to be tread carefully on that because I can't legally say, hey, this is quote unquote the best plan, but yes, I can lead you the right direction and make a recommendation based on your needs. And that's what's always so tricky. Sometimes I'll sit down with a husband and wife. You have different medications, different health needs, and sometimes I'll say, I think you should be on a Medicare supplement plan, this high-end plan, and then the spouse, I'll say, geez, I think you should be on a $0 plan. I just don't think, so a lot of times I'll separate those, and I go through all the health questions with you. I look up every single one of your doctors, look up every single one of your medications before I make a recommendation. Thank you. So that's everything. So again, if anybody has any questions, everybody has my business card. They can reach me at any of those numbers. So please let me know what kind of questions you have. If you'd like to set up a consultation, or if there's anything that I can do to help you, I'd be more than willing to do
Just
that.
one more question.
Of course.
You said primary care doctor is a recommended specialist.
Only on an HMO. If you have United Healthcare, you do not have an HMO.
Okay.
So if you have United Healthcare in this county, you're on a PPO. They do not offer an HMO in Berrien County.
The Advantage plan is on the.
The Advantage,
Where is Advantage plan from?
the Advantage plans in this area, probably the top 3 carriers are Priority Health, Humana, and Blue Cross Blue Shield. Is that your question?
Well, do I still have to get a referral from my doctor?
No. If you're on a PPO plan, that's the only thing I would ever recommend. If anybody wants an HMO, you're going to have to twist my arm, because I don't recommend doing an HMO plan. A PPO plan, you do not need a referral to see a specialist. You can go and do as you please.
Now, this is the HMO plan, is that the one that you can't, like, cross state lines?
Sometimes. That's when there's the restrictions on. So that's why I don't like them in this area. We're too close to a state line to be on an HMO.